All right, so thank you for those tallies. Now, authorities here have been taking subtle but steady steps into a new normal over time as they seek to usher in an endemic phase of COVID-19. For more, Shin YE-EUN joins me now. YE-EUN, good to see you again.
Thanks for having me, Sunny.
Right then, let's begin with efforts that have been made thus far, YE-EUN, to manage COVID-19 more like the common flu then.
Right, so from last November, most people infected with COVID-19 have been asked to recover from home, and recently authorities have allowed anyone to receive in-person treatment for COVID at local hospitals if they want to. Now, they're looking to expand the number of hospitals that provide medical services for COVID patients. Currently, there are some 4,800 outpatient treatment centers in the country. Take a listen to what the Minister of Interior and Safety had to say.
We will continue expanding the number of outpatient treatment centres for COVID-19 at local hospitals and clinics, providing in-person treatments. We will also kick off outreach treatment programmes where medical staff visit high-risk facilities like nursing homes themselves.
Authorities could also shut down residential treatment centers, which had been set up in the early days of the pandemic to treat COVID-19 patients with mild symptoms. With home treatment now becoming the norm, except for those without shelter, residential treatment centers are being little used. As of now, only 19% of all beds at residential treatment centers are occupied, and health authorities believe medical resources allocated here could be better used elsewhere.
Right, and that of course makes sense. Now, for COVID-19 patients at home, YE-EUN, I understand they can now venture outdoors to pick up their medication.
That's right. Authorities on Wednesday have decided to allow those infected with COVID-19 and recovering from home to pick up their own medication at pharmacies. This as many home recovery patients have found it inconvenient to have an uninfected family member or friend go and get it for them. Now, this was especially problematic for those living alone without anyone to visit a pharmacy on their behalf. Health authorities have provided new guidelines for home recovery patients to make a run to the pharmacy without putting others in danger.
We ask those infected to stand outside the pharmacy and stand 1 meter apart from each other when waiting for their medication. We will also create storage areas where people can pick up their medication with minimum contact. We kindly ask everyone to refrain from talking to others and for pharmacies to abide by all prevention measures.
And the government has promised incentives to pharmacies that provide in-person prescription to those infected. What these incentives are, we don't know yet.
Meanwhile, on the treatment front, YE-EUN, as Soa mentioned back on Tuesday, we're expecting antiviral pills to a greater number of patients in the country then.
That's right. Now that the government has secured enough supplies of oral treatments, they're making these antiviral pills more accessible. Some 420,000 courses are available for use this month. From today, residents at nursing homes and mental health centers where many infections have occurred recently can receive antiviral pills from public health centers. Authorities have supplied public health centers nationwide with enough antiviral pills to immediately supply other medical facilities and nursing centers in need. Each public health center will receive antiviral pills from Paxlovid. That's enough to treat 100 people, and from Lagevrio, enough to treat 24 people. Now, these centers can also request more supplies if needed.
I see. All right, YE-EUN, thank you for now, but do stay behind for more talks.